When I was a sophomore in college, I got a phone call. Those were the days when phones were at the end of every dormitory hallway, that my mother was near death. It was finals week, and I skipped my exams. I flew home, and I sat right next to her at her bedside. And what I didn't expect was her presence. I mean, it was really beautiful and comforting. But my thinking mind was going, was I reaching her? Was I doing the right thing? Was I enough? And it turned out that question became a theme for me. So that many years later, as an oncologist, it stuck with me. Could I reach them? I remember a patient who really got to me, a young man with a cancer, a terrible cancer that just never gave him a break, who flew around the country looking for doctors to do out-of-the-box treatments, flew around the world. I never knew, was I reaching him? He was so self-contained. And then after a long series of treatments, very technical, very complicated, very out of the box, they were what we doctors would call heroic, but they were also brutal. He died. And he died leaving me with a sense of never knowing if I had been able to make contact with him. And it really haunted me. I was at a point in my career as an oncologist where that sense of whether I was reaching people was really starting to feel like a weight around my neck. I had been through all these different trainings, courses, books, people. I had visited almost every expert in the world, and I was considered kind of an expert myself. And yet I still felt inadequate in the face of what mortality really felt like and looked like. Then I heard about psilocybin-assisted therapy, how it could reset the way people approach their mortality, about how it could enable a kind of experience that would give people a whole different outlook. And I decided to try it myself. I knew that if a patient asked me, should I do this, I would never be able to look them in the eye and recommend it unless I could say that I had done it myself. So my own experience with psilocybin was very physical, very somatic. It turned out I had to shake off all the conditioning that was pent up in my body about what it meant to be a good doctor and what being unemotional and objective had left me with. I had to shake all that off to reach something else. And when I reached that other thing, it was something I didn't expect at all. It was like energy. It was like infinite and ancient and eternal. So I went into my trip asking, what I should be doing to reach other people better. And what I learned was what I wasn't reaching was something within me. Then came COVID. I live in Seattle. I live right across the lake from the first nursing home where it showed up. And it was overwhelming. I mean, it was a level of suffering and uncertainty that I had really never seen before in my career, even as an oncologist. I read the news today and my body remembers those feelings of helplessness, but also that feeling of resolve, because, we were running on instinct at the time. It was a survival instinct. Nobody had time to feel. We just did everything we could. And yet there was so much that was happening that we couldn't really deal with. That there was so much caring that we couldn't do because we were insulated from it. There was so much uncertainty in what the right thing to do was. There was so much injustice that we couldn't fix. And it was unprecedented. But emotionally for me, it was territory I knew quite well. So I thought, what if I scaled up my own experience with psilocybin into a study? I'm an academic, after all, that's what we do. And so I wrote this study about psilocybin-assisted therapy for doctors and nurses and advanced practice providers who had depression and burnout from their frontline work. These are all people who had seen many, many deaths. And when we opened the study website, there were 30 spots and 3,000 hits. I thought, wow, what happened to me is not an anomaly. We are still analyzing all the data from this, and so I don't have an official scientific result, but I can tell you about a range of the experiences that I saw. And so some clinicians had experiences that were more in what I would call the psychological arena. One of them said to me in her first prep session, "I feel more disposable than a used COVID swab." And she said it like that. I mean, it was bitter. It was shocking and so sad. And in her trip, she went through that down to the helplessness and the rage and the grief, and somehow found her way to a place where she could reconnect with what had brought her into the profession in the first place, right? Then there were other clinicians who had an experience that I wasn't really prepared for altogether. One of them said, "Unlike my regular processing that was in my head, this was like energy flowing through my hands and arms and chest, powerful waves of energy that would end in very clear messages like, we are one, we are guardians of light and love." And I learned how important it was for me to understand that at best, I help identify what is distracting someone from what is in them and how to help connect them with what they already are. That what I do really is reconnect people with their own healing. And I learned about my own tendency to be a superhero and my own tendency to make it all about me. I thought, it's interesting that he's telling this to me, right? This is like a message, Earth to Tony, right? Hello. And so then, and one more patient, one more participant, I will say. Someone who said, "I experienced multiple deaths. I became my patient. I had that physical death. I watched myself leave that body and float up, and then I could feel this other energy that felt like source. And I saw the absurdity of the universe and the infiniteness of it, like there is a pool of source energy. And then it turns up in manifestations now and then that are people or trees or whatever, but we are that source energy. But once we disconnect, we start to become it's isolating, it's lonely. We cling to the attachment to the body. But if we are able to grab that back somehow, reconnect to that source, or be conduits for reconnection, then the I disappears and we become connected again. So for me, as a doctor and an oncologist who was trained to see the body as a machine, right? The body is a big chemistry experiment or an immunology experiment. This has been a real shift in worldview, right? Technology, it turns out, does not heal us. I am not anti-technology, right? I mean, I am grateful for every day that I had with my mother that was made possible by that medical technology. But what I have learned now is that there is a kind of healing that comes from a source bigger than the technology humans can build and the culture of the individual me. One of the patients in a study I am doing now who has metastatic cancer talked about their psilocybin experience this way. For a period of time, nothing made sense. And it was funny to realize how absurd it was to even make sense of things. I felt a billion colors. I felt love like I've never felt love before. I objectified my cancer. I wanted to be angry at it, yell and scream, and then started laughing at how absurd that was. So I gave it a hug and loved and forgave, right? Loved and forgave. I wrestled with the idea of death, but it didn't seem possible. It seemed like my body could die, but my feelings could never die. And I know this sounds silly, but I realized death is love. Death is love. So for now, I'm calling this a kind of soul work. You know, psychedelics might not be the only way, and they might not be for everybody. But what they are reminding us of is that mortality, coming to terms with our own mortality, is a kind of work of the soul. Work about how we relate to the part of us that is deeper than our individual selves, work that happens through our bodies, through our connections with each other, and through connections to source or nature or the eternal or whatever you call it. Imagine if there were patients who could have those experiences, who were lifted up and supported by doctors and nurses and doulas and therapists who could hold those experiences because they themselves had had them, right? It would be a different way for us to be with our mortality and with the grief and with the suffering and with the whole shebang, right? It would be a different way of being with all that could be sustainable and maybe even regenerative. I mean, imagine if reconnecting with our source as a way of coming to terms with our mortality was a way of regenerating love. Thank you.